Hi, I'm Kresta, and as we expected, Planned Parenthood is doing its best to avoid the substantive issues raised in the recent undercover video that shows their Senior Director of Medical Services, Dr. Deborah Nucatola, acknowledging that Planned Parenthood affiliates do receive money for aborted fetal body parts.
I'm going to throw a number out. I would say it's probably anywhere from $30 to $100, depending on the facility and what's involved.
The $30 to $100 price, that's per specimen that we're talking about, right? Yeah.
Yes.
They're hiding their unethical behavior by holding up the fig leaf of altruism and benevolence. But there are at least three serious issues here that they can't escape. Number one, Planned Parenthood's consent form does not inform the mother that Planned Parenthood has a financial interest in the dead baby's body parts. Two, Planned Parenthood violates the ethics of patient care by altering the abortion procedure for reasons other than the well-being of the mother.
And with the calvarium, in general, some people will actually try to change the presentation so that it's not a vertex, because when it's a vertex presentation, you never have enough dilation at the beginning of the case unless you have a real huge amount of dilation to deliver an intact calvarium. So if you do it starting from the breech presentation, there's dilation that happens as the case goes on, and often the last you can evacuate an intact calvarium at the end. So I mean, there are certainly steps that can be taken.
So they can convert to breech, for example, at the start of the...
Exactly. Under ultrasound guidance, they can just change the presentation.
This is on a par with treating a dying person differently because you know you're going to harvest their organs. The objective is always the well-being of the patient, not how you can use the patient for some other objective. And three, national headquarters of Planned Parenthood Federation of America are fully aware, supportive, and approving this practice of their affiliates. Here are a few notes on each of these 3 points. First, Planned Parenthood will claim that the money they receive is just covering their expenses, that they're not selling body parts. But the Center for Medical Progress claims that all the expenses of transportation, preservation, implantation, etc., are borne by the research lab purchasing the body parts. Planned Parenthood has no expenses in this. They receive money coming and going. They get money from the mother seeking to abort, and then they get money from the research lab who comes right to their door to pick up the specimens. Number two, Dr. Arthur Kaplan is one of the fathers of modern bioethics. He's a supporter of Roe v. Wade, but even he is concerned about Planned Parenthood's practice. He told CNN's Elizabeth Cohen that the sole concern of the abortion provider should be the well-being of the patient, not the worry over whether they can extract undamaged fetal body parts. Quote, in abortion, the goal is to give the safest abortion possible. Your sole concern has to be the mother and her health. End quote. Doctors should treat the patient as they normally would, and then use whatever is available after death. On the undercover video, Dr. Nucatola admits they do just the opposite. Planned Parenthood has, admittedly, a huge conflict of interest. Number three, Dr. Nucatola admits on the video that Planned Parenthood Federation of America's lawyers are squeamish about this practice. They knew about it.
At the national office, we have a litigation and law department which just really doesn't want us to be the middle people for this issue right now.
And they've warned headquarters not to get involved. Consequently, headquarters has always publicly distanced themselves from any affiliate who gets caught doing this kind of monetary transaction. Well, now we know that headquarters knew about it. Headquarters approved it. Headquarters supported it. Planned Parenthood is trying to say they're not technically selling these body parts. The courts will determine whether or not this is criminal sale of body parts. What we clearly know is that they have a financial interest which they don't disclose to the mother. They do receive money, and they unethically alter abortion procedures in the interest of the research lab acquiring the body parts rather than in the best interest of the patient.
We've been very good at getting parts on liver because we know that, so I'm not going to crush that part. I'm going to basically crush below, I'm going to crush above, and I'm going to see that get out intact.
And all this is known at the highest levels of the Planned Parenthood Federation of America. Cecile Richards, president of Planned Parenthood Federation, is going to need something much bigger than a fig leaf to hide her organization from the eyes of the law and the scrutiny of the U.S. Congress. I'm Kresta. It's always good to hear from you. Thanks.